Hi, in today's video, as part of my comments on psych meds by a psychiatrist series, I'm going to talk about clonazepam, brand name Klonopin. This is a medication, a class of medications known as benzodiazepines. And the main use of Klonopin is for treating anxiety. Um, as with most benzodiazepines, it's mainly used to treat acute anxiety, meaning it works pretty quickly on the spot. Uh, Clonazepam is a little bit unique in that it is the one benzodiazepine that is sometimes used to manage a certain kind of anxiety, panic disorder, on a more long term basis. So it can sometimes be used on a long term basis, but that's really going to be the exception rather than the rule. Uh, Benzodiazepines can be potentially habit forming, and for this reason, we prefer to use them for short term benefit and hopefully alleviate anxiety using other medications that do not have the same risks as benzodiazepines. Because they can be habit forming, I think it's very important that they are prescribed by physicians who have experience managing benzodiazepines, so psychiatrists, addiction specialists, and the like. Occasionally, benzodiazepines and Klonopin are also used to help facilitate sleep, but I think that there are better alternatives for sleep to help avoid the risks associated with clonazepam and other benzodiazepines. So I don't think they're off the table, but they would not be my first choice in trying to assist people with sleep. Clonazepam comes in dose strengths of half a milligram, 1 milligram, and 2 milligrams of the regular formulation. There is also a form that dissolves under the tongue, and that quick melt form is available in a smaller dose strength. But I tend to not use that, so I tend to stick to the half milligram, 1 milligram range. That can be given. That can be given in some cases up to 4 times a day, but I will generally try to stick with twice daily dosing because clonazepam is a benzodiazepine with a longer half life. So twice daily maximum should be sufficient. There are some patients who do use a third dose daily. Seems to work better for them. But again, this is the exception. Mainly, I want patients to use it for occasional use for flare-ups of anxiety. For patients who are using it as a long-term management tool for whom other medications just don't work, a twice daily dosing schedule is about as high as I prefer to go. And that's going to be either half a milligram or 1 milligram twice a day. Coming off of clonazepam is a very or can be a very difficult process, but basically you do a very gradual taper, and for some patients who really have a hard time giving it up, we'll sometimes use a substitution strategy to use other medications to come off. The main issue that limits the ease of coming off of it is that you get rebound anxiety if you come off it too quickly or are having trouble coming off that last dose. There's an increase in anxiety, which can be very pronounced for certain patients. And the side effects of benzodiazepines are they can be sedating, so that's a common side effect. In high doses with regular use, you can see some cognitive effects, slowing down of both cognitively and also reaction time. This is another key precaution is that benzodiazepines should not be mixed with alcohol because the effects overlap in terms of the impairment and the like. So those are the main comments I wanted to make about clonazepam. There is more to say, and perhaps at some point in the near future I'll make a follow-up video to get into more detail. But main use is for anxiety, and I think should be managed by somebody with a good experience with prescribing benzodiazepines, and it should be limited to short-term use if at all possible. Okay, thanks.